it's becoming less of a problem with youth and more of a problem with midlife and older adults. Kia ora, my name's Andy Towers and I am an Associate Professor in Health Sciences at Massey University and I am an affiliate with CFAR.
Kia ora koutou, my name is David Newcombe and I'm an Associate Professor here at the University of Auckland. I specialise in addiction studies and I'm also an Associate Director at the Centre for Addiction Research.
We found that in adults in New Zealand aged 50 plus, about 35 to 40% of them in our study were technically hazardous drinkers, and that was astounding, and that was certainly a finding that the Health Promotion Agency was shocked about, and so were we. Hazardous drinking is a funny term. It's a public health term, so it actually incorporates a range of different drinking behaviours, some of them that are immediately harmful for your health, and that's things like binge drinking, 6 or more drinks or more drinks in one occasion, and other patterns that relate to harm over the longer term. So they're not maybe as high quantity, but more frequent drinking across the weeks or across months. So it's a bit of a range of different drinking patterns. Some of the harms, the immediate harms of high level drinking are things like blackout, crashing, violence, domestic violence. Those are for drinking a lot in one instance. But even if you're drinking low levels of alcohol over a much longer period for years, then there is much more increased chances of things like cancers all over the body. From as soon as the alcohol comes into your body, all of the systems it touches, you can get cancer from that, as well as cardiovascular diseases and a range of other chronic health conditions.
As we get older, our physiology changes. We tend to lose a lot of muscle mass and we have less body water, which means that the alcohol that we're drinking has less water to be dissolved in, so we have a higher concentration, so we are more sensitive to the effects of alcohol.
There is no benefit of alcohol. At a minimum, there's no benefit. International comparisons are quite concerning. We have the silver medal in terms of the number of adults aged 50 plus that drink in around the world. So we are beaten only by England, but only by a little bit. So basically 80% of Kiwis aged 50 plus are drinkers. But as soon as you break that down into how frequently you drink and how many drinks you have on a single occasion, we absolutely, unfortunately, are the gold medal winners. We still see in our international comparisons that Kiwis are much more likely to binge drink whenever they drink. They drink to get drunk, not drink to enjoy. What we find over and over and over again, both here and internationally, is that men are always at the forefront of all of these harmful drinking patterns. Men are always more likely to be binge drinkers, they are more likely to be more frequent drinkers, and they're also much more likely to be dependent drinkers of alcohol.
Alcohol is normed in society. A large proportion of us do drink, and we've shown that the pattern of drinking is often established very young in adulthood, and we retain that pattern as we get older.
The earlier you initiate alcohol, the more likely you are to be a hazardous drinker, not only in later life, but throughout your entire life. And what we find in this study is that the more you're from a poor background, the poorer your family, the more likely you are to be a hazardous drinker later in life. And secondly, if you have a parent in the household who was a harmful drinker themselves or a hazardous drinker, you are about 5 times more likely when you start drinking to be a hazardous drinker yourself. The next step really is to focus on how do we enhance screening for New Zealanders aged 50 plus. No matter how much Kiwis drink, they go to the GP. So the GP is a perfect point of intervention.
So it's an opportunity to provide some preventative measures to prevent adverse consequences happening. And it's all about reducing the burden of ill health in society, to the individual but also society. Yeah. The enhanced screening protocol or algorithm is essentially a set of rules or instructions that are embedded in the patient dashboard. that the GP is looking at. It sifts through information and is able to detect whether the individual older adult is drinking in a hazardous way or not, and that the health professional will get an indicator to say this person has a likelihood of alcohol-related risk, and have that conversation. And that allows the health practitioner then to provide an intervention of some sort. It's pragmatic, it's ease of use, and it's detecting those missed elements that haven't been part of screens before. In terms of public health, this is a very important preventative measure that we can. The goal is to prevent the consequences of long-term regular alcohol use, and really a lot of it is about information and education. So that's essentially what this is all about.